Disclosures everyone's seen. So objectives, we want to recognize the non-unions after pelvic stress tabular osteotomies, be able to evaluate some of the local and the systemic risk factors for that non-union. And then as Florence just mentioned about correcting modifiable risk factors for whichever problem you're solving, anything you can do before surgery obviously is going to support the indications for surgery later. So anything we can do to make that environment better without surgery is important. And then restore the appropriate environment for fracture healing and osteotomy healing. So I did what anyone would do, is I went and asked ChatGPT, what do we do for non-unions? And it gave me actually a very interesting answer, but I'm going to hide that for now. And then I said, well, that's stupid because the O in PAO is for osteotomy, so it's redundant. So these computers are getting there, but they're not quite as smart. So I'm not going to give you the answer that fast, but I will show you what it said at the end. Here's my case, patient of mine, BMI is a little elevated. We know that's a risk factor. Bilateral hip pain, right was worse than left. So we did the right PAO and everything went fine. She did great. About a year later, we go and do the left side. I'm thinking we'll just do a mix, an exact mirror image, get the right correction that we wanted. So here she is. And you can see on her right, I bring my own pointer here, her right, we had a nice union here. Everything seems to be remodeling. I did concomitant femoral osteotomies at the same time. And on the left side, everything's starting to go. This is about 3 months out, just still having a non-union at the pubic cut here. You can see with her obesity, everything was a little bit more challenging, as well as, and I didn't mention this earlier, but we did have to bring her back, I'm trying to remember of which side, for some soft tissue wound healing issues. So here's the Lacane views for both sides. So I was reasonably happy with the correction and everything, but at 6 months, she's still having problems, and at this point, she's actually symptomatic.